The following video attempts to analyze critically the extensive systematic review carried out by Walker and colleagues and published in 2007 in The Lancet over the best quality scientific literature available in developing countries. It's a research that seeks to establish priorities for addressing those risk factors that could be present from pregnancy and early childhood and have a negative impact on the physical and intellectual development in late childhood and adolescence. It is a fact previously demonstrated by the extensive scientific literature that there are social determinants from early childhood that have repercussions through psychological and biological mechanisms in child development. But I think the most valuable aspect of this review, this systematic review of those works made in developing countries before, is that this work addresses both from an ethical and pragmatic point of view the priorities to tackle those risk factors that appear to be closely related to negative outcomes in child and adolescent development. Regarding the inequities, as the publication of Walker in The Lancet stresses, in some developing countries both poverty and socio-cultural aspects appear as determinants of environmental, biological and psychological risk factors that act as multiple and cumulative risk during the early stages of life. To childhood undernutrition, from chronic infectious disease like intestinal parasitosis, to low cognitive stimulation because of caregiver deficits, from contaminated drinking water to exposure to violence. The aim of the research was to establish the avoidable negative factors derived from early childhood, even pregnancy, that affect the physical and psychological development in late childhood and young people. This was made through gathering the best information about different factors already addressed in previous research conducted in different developing countries. We can see here Colombia, Brazil, Chile, India, Bangladesh, China, Taiwan, Indonesia, among those countries that have had previously studies over the issue. Regarding the quality of the evidence, as the strengths the study has, the use of well-documented studies with standardized measures of outcomes. For example, the comparison of trials in different countries regarding the benefits of iron supplementation at 6 months life and the utilization of Bayley Mental Development Index at 12 months or equivalent. Also, the researchers have chosen studies that make a correlation of causation. For example, intervention studies were reviewed, especially if they had a good design, like avoiding of confounding factors, an important thing. They have chosen prospective cohort studies and randomized trials over associational studies when it was possible. I think the weakness of the design may be unavoidable because of the multiple countries involved, is the many different design of studies and the reliability of the methodology and collection of records for the databases used in each country. About social determinants and health inequalities, I was pointed in the article Health Disparities and Health Equity of the Annual Review of Public Health. We can define health disparity as a particular type of difference in health. It is a difference in which disadvantaged social groups such as the poor, racial, ethnic minorities, women, or other groups who have persistently experienced social disadvantage or discrimination systematically experience worse health or greater health risk than more advantaged social groups. Regarding the key results, the inequalities in health in developing countries are expressed through risk factors that act cumulatively from pregnancy to early childhood, and are listed in the graph here, extracted from the review, where above the arrow we can see situations that the authors consider as needing an urgent approach. Here, stunting, inadequate cognitive stimulation, iodine deficiency, iron deficiency, anemia. Below the arrow, those situations that have been demonstrated with a close correlation with developmental disorders and that deserve intervention also at the public health level as well. Here are the consequences. How do the authors plan to address the results? The Health in All Policies Implementation brochure, published by WHO in 2018, places the issue of social determinants of health at the top of the key drivers of its implementation. In close relation to that, formerly, this review of Walker in 2007 addresses the social determinants in many development countries through an extensive review going further and deeply, recommending direct and urgent actions over the main related factors that came up from the research, and being present during pregnancy and early childhood affect in direct way the further development of children and adolescents. Here, the early stimulation, the iodine deficiency, and the iron deficiency. Finally, one of the most important achievements of the review here analyzed is to ensure avoiding those proven factors that compromise late childhood and adolescent development are transferable to other environments that are not necessarily framed in developing countries. That is, it is important to detect health disparities in health communities, for example, working with minorities in large cities, in order to focus on generating health public actions adapted to each particular population.